It's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with the latest health news. Linord.
For the first time, the World Health Organization is issuing guidelines to help health workers provide better physical and psychological care for the women and girls who have undergone female genital cutting or mutilation, FGM. FGM involves the partial or total removal of external genitalia or other injuries to the female genital organs for non-medical reasons. The WHO notes that health workers are often unaware of the negative consequences of FGM and do not know how to treat it. The new recommendations focuses on preventing and treating obstetric complications and on helping women with depression and anxiety disorders. The practice is prevalent in Africa, Asia, and the Middle East. With increased global migration, more cases of FGM are occurring in Europe and North America. New international guidelines aim to reduce by 50% the cost and time for treating multi-drug resistant tuberculosis. The World Health Organization is recommending a new, easier and cheaper treatment for multi-drug resistant tuberculosis, also referred to as MDR-TB. WHO says it will save the lives of tens of thousands of people every year. Nearly 500,000 men, women and children worldwide develop MDR-TB, and each year almost 200,000 of them die. WHO says the death rate is high because fewer than 20% of the patients receive proper treatment. Mario Raviglione, director of WHO's Global TB program, says a new test and a new treatment regimen could be a game changer.
The World Health Organization is recommending today the only test we have available now for the detection of additional resistance in patients with multi-drug resistant TB that can be done now in 1 day rather than in 2 or 3 months as it used to be.
The shorter treatment regimen costs less than $1,000 per patient and can be completed between 9 and 12 months. Conventional treatment programs for people with multi-drug resistant TB take between 18 and 24 months to complete at a cost of $1,500 to $3,000. This form of treatment is recommended for patients diagnosed with uncomplicated MDR-TB, such as those whose infections are not resistant to the most important drugs used in treatment known as second-line drugs. It is also recommended for individuals who have not yet been treated with second-line drugs.
This is a critical step for the fight against multi-drug resistant tuberculosis that affects today 500,000 people. We believe that hundreds of thousands of patients will now benefit from this new recommendation.
WHO says the conventional treatment regimens yield low cure rates at just 50% on average globally. Many patients fail to complete what some find to be a burdensome course.
WHO is working very closely with countries and with technical and funding partners to make sure that as quickly as possible countries implement and roll out the new technologies and invest the savings, especially on the short regimen, invested in accelerating the crisis response to MDR-TB.
The new recommendations on the shorter regimens are based on initial studies involving 1,200 patients with uncomplicated MDR-TB in 10 countries. A new study announced that huge numbers of people die because of the mistakes made by their health practitioners. The study shows that medical errors is one of the major killers in the United States and perhaps globally. Here is VOA's Pearson.
If we treated medical error as a disease, it would be the third largest killer in the United States.
A jolting statement from the latest study on deaths caused by medical mistakes from study author Dr. Marty Makary. No one knows how many people actually die because of these errors. The Centers for Disease Control and the World Health Organization use billing codes to determine the principal causes of death. Without a code for medical error, Makary says the problem cannot be studied or corrected. He says it's the only area of medicine that is not documented.
I see a patient with cancer and I have to document the age and stage of the patient and the subtype of the cancer. And that goes into our national registry, and each year, with millions of dollars of investment, we put out our national cancer statistics. All the types and subtypes broken down in this complex report. We should do the same for medical error.
Mistakes can be made when there are too few nurses or not enough training. And there are other risky situations as well.
The most common dangerous procedure in an emergency room today, according to many emergency room doctors, is a patient handoff.
That's when the staff changes shifts or patients are sent for a procedure and their information is not passed on. Makary says mistakes cannot be totally eliminated, but they can be greatly reduced.
Unless we can accurately document the role of medical care gone wrong, we can't really appreciate the problem.
That requires a change in the system so health workers can find the weak spots and work to eliminate them. Carol Pearson, VOA News, Washington.
That's our health report for today. To stay in touch, well, find me on Twitter at Linord Moudou. Back to you, Vincent.